Hello everyone, my name is Grazia Ciocci and I'm Deputy Director at Healthcare Without Harm Europe. I would like to welcome you to the webinar on innovation procurement of food and catering services for the healthcare sector, and today I will be hosting this webinar. The webinar is organized by Healthcare Without Harm Europe and it's sponsored by the EcoQUIP project. Today we have two distinguished guest speakers, Gaynor Wales and John Cartwright. Gaynor works at Yera Consulting, and Yera Consulting is a partner in the EcoQUIP project, and she will talk about innovation procurement and the EcoQUIP project itself. Then John will talk about, John is Director of Estates and Facilities at the Rotterdam NHS Foundation Trust, and John will showcase a successful procurement project at Rotterdam Hospital, where they revolutionized the catering service to make impressive cuts of energy use and CO2 emissions. I would like now to give the floor to Gaynor Wales.
Thank you very much, Grazia, and welcome to everybody, and thank you for joining us today. My job is to give you a short introduction to the EcoQUIP project and to give you something of an overview of the methodologies that we've been using in innovation procurement. So first of all, the EcoQUIP project is funded by the European Commission, and it was one of a number of projects that was funding started now more than about 4.5 years ago. And it was one of the early innovation procurement projects. And at that time, there was very little to show and demonstrate the success and potential of innovation procurement. It was still very, very new. And this was a second round of projects that was something like 5 projects that were funded by what is now DG Growth. So our aim, our underlying aim for EcoQUIP, was to try and come up with some good case examples to demonstrate the potential of innovation procurement, with the objective of delivering things that the healthcare sector needs and improving the efficiency, i.e. the cost effectiveness of that product or service, its quality and its environmental sustainability. And I emphasise the word "and" because in many people's mind, the possibility of delivering efficiency, quality and sustainability seems quite a remote possibility. But in all the projects that we have completed successfully so far, that has most certainly been the case. So we now have a good set of case studies, and John is going to talk to you about one of those, specifically looking at food and catering services in the healthcare sector. What we also wanted to do was to find a way of bringing individuals together to exchange and share their experience of innovation procurement, so to create effectively a leaders group of people who could continue to work in this area and also to develop the methodologies. Because let's remember, it is still a very new process, and we were lucky to have a range of different projects across many regions of Europe, and so I think we can say categorically that everything is possible in terms of innovation procurement, but it does require us rethinking the way we do things. At the heart of EcoQUIP were a number of pilot innovation procurement projects. We were of the view that the way in which people can learn best about innovation procurement was to try and do it, to actually pull together a pilot project and actually see how it would be implemented in their particular circumstance. The aim of these pilot projects was to demonstrate and offer good examples of good practice. That's what we were aiming to do, and so far we've had great success. As we come to the end of the EcoQUIP projects, we can say that the pilots have demonstrated that it is possible to encourage and stimulate the supply chain to bring forward new solutions and products. In doing so, deliver more efficient, higher quality and more sustainable goods and services by adopting the innovation procurement approaches that I'll be describing. And the way in which we carry out procurement can be changed to deliver better outcomes. And I think this is often feels a very difficult thing to do. It is effectively a change management process, which takes time and takes a lot of commitment by the people involved. We also encountered, as you can probably imagine, a number of barriers in the implementation process. Specifically, the regulatory barriers have proved very difficult to overcome in some countries, but not impossible. And now we're in an environment where the new procurement regulations give us much more scope to adopt innovation procurement processes. I think that will be a great help going forward. Of course, there's also a lot of cultural barriers. And again, by understanding what we're trying to do and to demonstrate its possibilities and the value it can bring, that really does help people to say, okay, let's give this a go. So the main message, I think, of today and of the pilot projects is if you want better and more sustainable goods and services, you don't have to pay more for them if you procure them using different approaches and approach the way in which you do procurement in a different way. So let's think a little bit about innovation procurement. Very simply, it's about undertaking the procurement process in a way that stimulates the supply chain to invest in developing new and better goods and services to meet your specific unmet needs. So it's all about the process. It's all about the way in which we go about doing something. In doing so, we can really unlock the creativity and innovation potential of suppliers. What I would call normal procurement processes can often lock in old solutions, and they can often hinder suppliers. Suppliers aren't inclined to innovate if you keep buying their goods and services because they're worried that actually this seems to work, and if we change it, maybe you won't buy it. We've always been very nervous about using the word innovation because it's a very scary word for people. It sounds risky, it sounds expensive, and it might not work. So when we've actually approached people, we've often said, okay, innovation procurement, it's all about getting the goods and services you need when you need them at a price that reflects their value to you. But it is quite difficult. Bringing about change in any organisation takes a lot of commitment. And there's lots of reasons not to change. There's lots of reasons not to do things differently. It might not be your job. We may have tried it and it didn't work. And we've seen someone else try it and we're not quite sure we can do that. It isn't the way we do things around here. And very often the message we get is, well, we're doing that already. Well, when it comes down to it, not really, but okay. And sometimes I think it can feel like a complicated process, but it isn't. And I think the case studies really can show us that it just requires us thinking about things in a different way. So the question we ask ourselves is, okay, change is difficult, and there are many, many reasons why we wouldn't adopt new processes. But the question I would pose to you is, like, actually, can we afford not to? The healthcare system, as you're all too well aware, across Europe and globally, is facing an awful lot of pressures, a lot of challenges. There's increasing pressure on budgets. In UK, we are experiencing considerable constraint on public finances and requirements for massive efficiencies in the healthcare sector. I'm sure that is a common experience. There's a gap between what we're able to offer and what their population needs, and we've got demographic change. We've also got higher expectations from patients. New technology is creating new opportunities, but we need to find a way of buying new solutions in a way that minimises their risks and enables us to value and utilise and harness their power. We've also got problems like increasing hygiene and infection control issues that need to be addressed, as well as major problems with things like antibiotic resistance. So big problems. And last and most certainly not least is environmental problems and targets, and also the pressure that environmental problems put on the healthcare sector. And I would name air pollution as one very good example. Air pollution is caused by the way in which we are managing our energy and transport system, but the people that pick up the price of the cost of that air pollution is the healthcare sector, and ultimately the patients who end up with respiratory diseases and early mortality. So there's much to be gained by thinking about how we can bring new solutions to solve some of these problems. How can we bring them forward? And innovation procurement is not all of the solution, obviously, but it can be a very important part of it, and it's a tool that I think is underused and one that I think we should continue to apply and exchange experience on. So we have a typical problem, what we would call the buyer-supplier paradox. On the one hand, the customer is saying, well, actually, if there was a viable solution and if I could afford it, we'd buy it. We want to solve our problems. And on the other hand, suppliers are saying, well, if there was a demand for solutions, we would invest because we like to create business and we like to meet the needs of our customers. The problem is that those two sides don't communicate very well. And so innovation procurement is a tool that can create better communication between the customer and the suppliers, between the customer, the healthcare sector in this case, and the supply chain, the market, if you like. And the role of innovation procurement is to create the missing demand to which the supplier can respond to bring new solutions and options available to the customer. So customers tend to buy what is available rather than asking for what they need. This is normal. We maybe buy off a catalogue or we buy what we bought last time. And very often what we tend to do is the only change we're really looking for is cost reduction and efficiencies. And that was certainly the case, which I'm sure John will be talking about historically in the catering sector in the UK. On the other hand, we've got suppliers who respond to customer and market demand. And in the absence of a clear demand from a customer, which frankly we're not very good at doing, suppliers tend to push their ideas and products. So this cartoon that we've got here is a very typical problem. Suppliers end up working blindfold to try and come up with solutions that they imagine and indeed hope that a customer wants. They come up with a solution and then go around looking for a problem to solve. And that's a lot of wasted resource, it's a lot of wasted effort, and it doesn't help the economy to grow, and it certainly doesn't help customers to come up with the solutions they need. So overall, it would be better for everyone if customers expressed their needs in a clear way to suppliers. And that is a fundamental part of what we would call innovation procurement. If you don't ask, you don't get. If you don't ask for what you want, you have to keep buying the solutions that the suppliers provide. And of course, in order to do that, you've got to be very clear about what it is that you do want. And if you don't know what you want, you can't ask. And this is a very common problem, is we don't spend enough time thinking about the outcomes that we actually need and finding a way of communicating that to the supply chain, giving them enough time to respond. And I've stolen a quote from John here, because for me it said everything. It wasn't actually about the project he's going to talk about, it was about a previous innovation procurement project. The key to success was to begin by asking for what was needed, not what we thought was available or affordable. And the solutions have exceeded all expectations. And I'm hoping that he'll probably agree that's true of his latest project as well. What we tend to do is limit our options to what we believe is possible, rather than challenging the supply chain to come up with new solutions. So, we came up with a methodology that would help people go through a process of innovation procurement to break down the procurement process into 3 stages: identification, market engagement, and then pro-innovation procurement. In the identification stage, we spend much longer than we would normally do in a standard procurement understanding what our unmet needs are and having an accurate understanding of the requirements that we have. And that means talking to end users. It means talking to the stakeholders, bringing together a cross-departmental team, bringing together people who are patient representatives with clinicians, with estates and facilities, with procurement. And that means you get a much thorough understanding of what works at the moment and what's going wrong, and it helps you inform your future specifications. And that's done way before the formal innovation procurement begins. So once you've got a good understanding of what you want, and you're really clear you want it, because you've got to be credible in the way in which you approach your supplier, you've got to be serious that you really are looking for this solution. Then we go into another pre-procurement stage of market engagement. And this is the point where people historically used to worry that we're not allowed to talk to suppliers. We carried out most of the projects that we've done under the old procurement regulations. The new regulations explicitly allow and positively encourage market engagement before the formal process of procurement, because that gives the market enough time to respond, and also for you to have confidence that yes, the market can respond to my needs and it can deliver. And that helps to galvanise the team and gives them confidence as they go into the procurement process. But you've got to communicate early in a way that convinces suppliers that you're serious. We don't have time to go into the detail of that market engagement process or the identification process, or indeed the pro-innovation procurement process, but we have lots of case studies and training materials. And if anybody yet does want to dig in a bit deeper, we're always happy to do one-to-one sessions with people. Pro-innovation procurement. Suppliers of innovative solutions and new solutions need the opportunity to offer those solutions on an equal playing field. And so the pro-innovation procurement approach is all about ensuring that innovative solutions are not, hindered from participating in the procurement process, that the procurement process doesn't favour your standard existing solutions. We broke down that 3-stage process into a number of specific steps. And the reason for doing this was, it made it a step-by-step process people could follow. And I think that helps when we're introducing new processes. And it gives us a framework to work to. Having got a framework, you can then adapt and develop that to actually fit in with the situation in which you find yourself. But it's still those 3 stages. And the identification stage is the stage that people most often spend too little time on. And it's a very important stage. And I'd encourage you to consider that and think about that. So, innovation procurement, let's summarise. What are we trying to do? We're trying to engage and support the supply chain to unleash its creativity, enable innovation. And there are a number of key features that enable us to do that. Fundamental is understanding what we need, giving thought to, do we really want to buy exactly the same solution, or can we uncover how we could get improvement? Can we uncover what the problems are with our existing solutions? Are there new standards that we need to work to? Can we predict trends in our demographic population, trends in the way in which we're going to approach healthcare? And let's give the supply chain as much information in advance, so early market engagement, and consult them to see, okay, are there barriers that we need to help the supply chain overcome to deliver? Are there other ways in which we could support the supply chain to deliver? And the sort of feedback we get from the market is very, very useful at this stage. Using outcome-based rather than technical specifications also means that the supply chain has a chance to be creative and come up with solutions that we might not have thought of ourselves. That's their job. That's what they're supposed to do. We don't have to work out what the answer is, but we do need a clear understanding of the problem that we'd like a solution to. It also helps support the supply chain if we can engage a wider market to demonstrate the potential market to a supplier. So asking other hospitals and your colleagues in other regions, in other countries, look, we've established a need for, in this case, low carbon people-centred catering services. Is this something you would buy as well? And that helps to convince the supply chain this isn't a one-off, that they could sell this to other people. In terms of the procurement process itself, there are a number of what I would call non-standard procurement methods that really support innovation. The pre-qualification questionnaire, if you're using them, can often eliminate exactly the suppliers that you need at an early stage of the procurement process. And a good example of that is in a previous project, we were looking for a ward refurbishment solution that had a hotel feel, that was thinking beyond a standard ward environment. So what we'd normally ask for is lots of experience in the healthcare sector. But we realised that if we did that in a pre-qualification, that would exclude people who had got experience in working in the hotel sector, exactly what we were looking for. So it's examining and looking at the details and making sure that you're creating opportunities for innovative suppliers to come forward. Competitive dialogue, technical dialogue, they're not things I think to be afraid of. I think we've demonstrated that they're incredibly valuable. And in the context of an innovation procurement process, they become much more efficient because you've done a lot of the dialogue and a lot of the refinement before the competitive dialogue begins. We have new tools available to us now, such as innovation partnerships. I have no experience of those, but there have been a few examples now in the UK that we can draw upon. I think an important factor is always a way in which we evaluate tenders. And again, we're often think about this a little bit too late in the day. And very important for innovation procurement is evaluating on factors other than price and helping a supplier to distinguish their offering on factors other than price. There's nothing more dull for a supplier to only compete on cost. So asking them to compete on value, asking them to compete, as in some examples, on degree of carbon reduction, on energy efficiency, is a valuable way of helping you to value new solutions that come forward. And also looking at the way in which we look at price. Is it actually what we pay for our product or our service, or is it what it actually costs me to own and run that product or a service? So a costing that takes into account not just its purchase price, but maintenance and energy consumption, for example. So there's not really been enough time to go into the detail of the process itself, but I hope that's given you something of an overview. When we began the EcoQUIP project, it really was a sense of it has never been done before. So we can't do it because no one's done it. Well, actually now we have lots of good examples, and I'm hoping that these can inspire you. We will have a final report available at the end of October, and just to start that process, I'll hand over to John, who can talk to you about his project in Rotherham.
I would like to thank you, Gaynor, first for your excellent presentation, and now we have a very good understanding of what innovation procurement is. Thank you very much. And I would like to inform the attendees that we will take all questions at the end of the presentations. Please, John, the floor is yours.
Okay, thank you very much, Grazia. Good afternoon, everybody. I'm John Cartwright. I'm Director of Estates and Facilities for the Rotherham NHS Foundation Trust, and one of the services that I manage is catering. What I'm about to go through today is a journey that took more than 2 years to get to. But prior to that, we did quite a lot of research with our own staff, our patients, visitors, to try and understand what they wanted from a new catering solution. So the first two slides are corporate slides, which is about the Trust's strategy and goals, and also our strategic objectives. So quickly moving on from those. When we started this journey, we had a vision, and what we wanted was an innovative, integrated solution for the provision of high-quality, patient-appropriate meals that are obviously enjoyable, attractive, clearly support the patient recovery, and is delivered as an integral part of nursing care. In order to do that, and going through the work we did with the focus groups of our patients and staff, we came up with a number of ideas of what we wanted. And the first thing was we wanted an innovative, patient-centred, low-carbon catering solution. But not for today, and not necessarily for tomorrow, but looking further beyond that. Because as we move forward in time and technology increases, we need to ensure that we keep up with the pace in order to make sure that we achieve all our targets and goals. We clearly wanted to improve our efficiency in the way we provided catering services within the organisation, and that will become clear as I go further into the presentation. Clearly we need to reduce wasted effort, energy and carbon footprint, but at the same time we wanted to push the boundaries of innovation in line with our ambition to operate at the leading edge of healthcare. But in order to do all this, we needed a framework that helped us to achieve this. So why did we actually want to do this? Well, with a 15-year contract that was coming to an end, we needed to be able to demonstrate a reduction in carbon emissions in transportation, food, production and disposal. We needed to enhance the patient experience through choice and service. People's expectations now are far greater than they were 15 years ago when they come into hospital. And in order to do all that, we need to ensure that we deliver the right meal at the right time to the right patient every time. And we also needed to review our catering approach and deliver to the patient's bedside while recognising one size does not fit all. So where were we? Well, we had a very labour-intensive service that actually still produced a quality product. We also had a labour-intensive, time-consuming method of delivery to the wards and to the bedside. And the quality of the product was being compromised through transportation delays and the actual food being served to the patient by the nursing staff. And this was giving us a negative feedback, which was not the fault of the catering supplier. It was in our own hands to sort this one out. And we also had a very labour-intensive, time-consuming method of menu collection from the wards. It was a paper-based method, and it required the nurses to go round and actually ask each patient what they wanted. And next meal ordering, which we were trying to achieve, was very nurse-dependent in many cases, and as probably Gaynor has alluded to, certainly within the UK, the activity within hospitals has increased considerably over the last few years. So where did we want to be? Well, we wanted a cost-effective, patient-centred, low-carbon catering solution. We wanted something that was effective, efficient and flexible, that is also patient-centred. Clearly, as a public body, we have to demonstrate best value, but at the same time, we need to understand best practice. And a solution that's capable of operating effectively in any operational health service environment. And my strapline through all this has been, if you get it right for Rotherham, you will get it right for the rest of the NHS. And that, for me, said it all to the market. If you can come up with a solution, the demand will be there for you to take on board. So how did we get there? Well, as a previous pioneer of forward commitment procurement, we decided that this would be a really good method of trying to get an optimal solution for what we want. We had an unmet need. The NHS has an unmet need for patient-centred, low-carbon catering solution. And we believed the forward commitment process was the vehicle that would stimulate the market to provide the innovative technical solutions that we believed were out there, but the market had not yet responded to. So we were looking for the market to make a significant response to our challenge. But there's also a reason why we needed the market to respond to our challenge. The NHS in the UK has been given a mandate to reduce its operating costs by 15 to 20 billion pounds over the coming 3 years. So the opportunity to succeed was huge on both sides. And if we're being honest, catering has come a long way in the last 15 years. New innovations and technology have certainly made what we are doing inefficient. And the NHS has to reduce its carbon emissions, and therefore it requires a step change in its environmental sustainability of its catering service as part of this. So, going back to what was our current model, we were coming to the end of a 15-year PFI catering contract where basically one size fits all. It was a plated meal solution, serving a large or a small portion offering to the patients. There were 3 standard set meal service times a day, with all courses served at the same time. Next meal ordering, but that could be anywhere from 2 hours to 4 hours, depending on the time of day. Ward staff had to assist the patients to order their meals. It was a paper-based menu system. It was a 2-week menu cycle changed twice yearly. And ward provisions such as bread, milk, biscuits, etc. were ordered and controlled by the ward staff. Water was provided to patients at ambient temperature, and bulk snacks such as biscuits were provided for distribution to patients. So what does our new service model look like? Well, it's a ward-based hostess service provided by the catering contractor. So every ward now has a ward hostess that is there from 7 o'clock in the morning till 7 o'clock at night, providing beverages and food and taking orders to each patient. And therefore the patients get to know the ward hostesses and they can build a relationship with them, helping to improve the patient experience. We were providing fresh cooked bulk meal service that is plated at the bedside, so that the patient has a choice of whether they want more of this, more of that, or less. We're also moving towards a room-style service for selected patient groups that have either missed a meal or require a meal outside normal times. And when we talk about that, we're talking about maternity departments where a lady in labour may not want a meal at the time of 12 o'clock when the meal trolley comes. So we need to cater for patients like that. We've also introduced a meal ordering system now. So that helps both in time in taking the orders, in times of getting the orders down to the kitchen, and reducing the length of time between ordering the meal and delivery, which is now approximately around 1.5 to 2 hours maximum. We also now have a seasonal 1-week menu cycle with chef daily specials, so the menu is changed 4 times a year depending on the seasons. We provide chilled water to patients via a hydration trolley, and the patients also receive a mid-morning and mid-afternoon snack, and some of that may be fruit or biscuits or something other that they may wish to ask for. We look to provide 24/7 hot food availability to both staff and patients via a cook-chill method, and we've opened for our staff and for visitors a new coffee shop in our restaurant. We also now got carbon-saving, energy-saving issues throughout the lifetime of the contract, and we are using things like eco boxes where staff purchase a plastic box, and from that, if they reuse it, if they take it home, wash it and bring it back and reuse it, they will get a discount on their next meal. All our waste goes to a refood anaerobic digestion process, which has been quite successful, and I'll touch on that later on again. So what were the innovations through the lifetime of the contract that we managed to get from all this? Well, the service model now distinguishes between the different patient groups to provide a more patient-focused, nutritionally appropriate meal, and a service delivery that, rather than the current method of what was one-size-fits-all, is now very flexible to suit every patient that we've got. And, you know, a typical example of that is we may have a sports person that's come in with a broken leg. They're actually not ill, so their food intake needs to be quite high. So this gives us the opportunity to provide such things rather than just giving them a large portion and hoping that would be enough. We now have an hydration trolley on every ward that has the ability to serve chilled drinks, hot drinks, and it also maintains toast that remains crisp. And one of our biggest complaints that we used to get was the toast that we provided at breakfast was soggy. So we've managed to eradicate that with a new hydration trolley that makes sure that the toast remains crisp at all times. We now have the patient meal ordering technology through use of handheld tablets, and this allows us to collect data on the most popular dishes, record meal by mouth, meal size and food wastage. And the fact that we cook on site allows us to provide a fresh cook chill menu. As I've said previously, our ward hostesses are there to provide full breakfast, lunch, supper service with support from nursing colleagues, in addition to beverage service and water jug service. Ward hostesses are responsible for ordering and controlling the ward provisions, and that has now been achieved. The current incumbent that is now delivering this has achieved already the Food for Life Soul Association Award at bronze level, and is hopefully due to gain the gold level in September this year, and they will be the first outsourced catering company working in the NHS to achieve such a goal. We are looking to introduce patient plan and passports, supporting patients through the dietetic and preferential requirements whilst in the hospital and into the discharge process, making a much smoother transition from leaving hospital and going home, and we're hoping to agree that later on this year. We've now got new energy efficient bulk delivery trolleys to be provided, and that's, as I say, been achieved. And we are trialling next month innovative new crockery that suits the needs of specific patient groups, i.e. dementia friendly. So what have we seen as benefits to the patients? Clearly they are seeing a more modern patient-centred flexible service. The portion size control at ward level, where the patients choose the size of the meal with each course being served separately, and that has been very welcomed. Reduced length of time to order as the maximum of 2 hours, and the ability to order food outside of normal meal services via a la carte cook chill menu, and that trial has just started this month. So we're hoping to roll that out across the Trust very soon. We have improved breakfast and beverage experience with the introduction of our new hydration trolley system. And as I've previously said, it gives access to warm toast, hot milk, breakfast time for cereals. We've introduced the electronic meal ordering system, and patients will receive the meal they ordered every time. And the benefit of all of that is it actually released nursing time back to patients, which was a key thing for us, to be able to give the nurses more time to attend the patients. In terms of benefits to staff and visitors, we now have a new premium brand coffee shop, which is Starbucks. We have an improved seating area within our coffee shop for people that wish to use it, and improved hot and cold grab-and-go options. I've mentioned the eco boxes, and again that's been quite successful, and the provision of 24/7 hot food through a cook chill menu. We already offer promotional and seasonal offers, and we're shortly going to be issuing loyalty cards to our staff for them to use every time they come into the restaurant. And again, to be launched this year, we're going to be allowing staff to order meals 24/7 through a meal ordering system. And we've replaced all our vending machines with much more energy efficient vending machines. And on top of all that, we've now got free Wi-Fi internet access within our restaurant. So what was the benefits to the Trust in all this? Well, clearly a better patient experience, and that is now being seen through feedback and self-assessments. Release of nursing time to care, to allow the nurses to care for the needs of the patients. We have a contract period of 5 years plus 5 years that promotes continued innovation and partnership working. And the idea of that was, you need to demonstrate to us within the first 5 years, Mr. Supplier, that you are going to continue to provide that innovation. And if you do that, we'll continue to provide the partnership working with an extra 5 years of the contract. And that is working really well, because at the end of the day, it is a partnership in all of this. We now have a flexible and responsive approach to patient feeding, a reduction in carbon emissions, both now and during the lifetime of the contract. All the new catering equipment that we required has now been installed, and also it's also released portering and domestic time. And this again has had a win-win situation for our nursing teams, because what the domestics are now doing is doing some of the cleaning that the nursing colleagues were previously responsible for. So again, we've put even more time back into nursing. Our food waste reduction has been quite good. We've actually reduced our food waste from between 5 and 6% to 2.5% to 3%. But the most substantial thing of all this is that in the first 5 years of the contract, the Trust will receive a financial saving of £800,000. And in the first year, we achieved that quite successfully, and are on target to achieve it in the second financial year. And as I've said, all of this has allowed us to improve our scores where external assessments are carried out in relation to the food and the food service as a result of the changes in the contract. But on top of this, a lot of lessons have been learnt, and we wish to share these lessons both with yourselves, with our friends in EcoQUIP, and anyone else within the NHS who wishes to understand it. And I suppose the first lesson that we all need to understand is never underestimate the commitment required. These things take time. They do not happen overnight. They do not deliver overnight. This has been almost a 4-year journey to get to where we are today. And it's taken a lot of time and commitment from my staff to be able to deliver such a project. And at the same time, you need to allow sufficient time to deliver the project at all stages of the process. Build in contingency time, because there will be inherent delays. Whether it's supplier delays, internal process delays, there will be delays. This took us 2 years to procure, but it was worth it in the end. Be prepared with your questions at the dialogue stage. The suppliers want to know, they want to understand what are your requirements. They want to understand what are your needs. So make sure you have your questions ready. Record all meetings accurately with prospective tenders, because you will speak to more than one prospective tender. And it's good post-tender evidence when you do that, and it eliminates uncertainty through the process, because there will be questions raised once the contract has been awarded. You will have thought they've said this, they may have said that, and if you've got that evidence, you can clarify. Most of all, particularly in one like this, make sure you have clinical engagement from the outset. Buy-in is essential, not only from our senior executives, from ward staff too, because at the end of the day, they've got to buy into this. And also good patient representation. We gleaned a lot from the feedback we got from our patients. It was massive, what they wanted from a catering service. Typically, you should stop and reflect throughout the project stages to make sure you're delivering the project brief and not what the contractor wants to deliver, particularly over such a long period of time. This allows you to maintain focus, because if you're not careful, the contractor will take you down a path that he wants you to go, not necessarily a path that you want to go. And if the current incumbent is bidding, question the bidding team to make sure the local team are involved. Because what we found, particularly with this contract, was there was a disconnect between the bidding team and the local team. Because at the end of the day, the local team are the ones that have to deliver the bid. And they become unsure of what's actually been offered. Set robust KPIs within the contract that ensures the contractor performs throughout the lifetime of the contract. This will ensure that we stimulate innovation throughout the lifetime of the contract. And finally, make sure you understand exactly what is being proposed or offered, as the reality may be somewhat different. So therefore, clarify, clarify, clarify. Never assume. Those are the lessons that I hope you take away from this presentation. Thank you. I'll now hand you back to Grazia.
Thank you very much, John, and thank you for sharing with us your new service model that you have implemented at your hospital, and for sharing all the great benefits for the patients, for the staff, for the visitors, but also for the environment. I would like to remind the attendees that we are taking all questions at the end of the webinar. And if any attendee needs to leave the webinar at the hour, since we are approaching the hour, we are running late, I would like to remind everyone that the webinar is being recorded and it will be available on Healthcare Without Harm Europe's website and on the EcoQUIP project's website. Now, I would like to share with you some challenges on sustainable and healthy food in the healthcare sector in Europe. Challenges that we have highlighted and we have gathered in a survey that we ran out for 2 years across European hospitals in Europe. Before starting to talk about the survey, I would like to say that Healthcare Without Harm Europe is a non-governmental organization, membership-based, with 76 members in 24 European countries. And our members are hospitals, healthcare systems, local authorities, health and environmental organizations that strive to transform the healthcare sector to make it more environmentally sustainable, and also a leader in environmental health and justice. We are the European arm of Healthcare Without Harm, which is an international organization with 4 offices worldwide. And Healthcare Without Harm, through its Global Green and Healthy Hospitals projects, reunites more than 600 sustainability healthcare professionals that represent 20,000 hospitals and health centers. One of the overarching goals that we have in our organization is public procurement, sustainable public procurement, that is both green and ethical public procurement. And I would like to start with a quote from Olivier de Schutter, the UN Special Rapporteur on the Right to Food in 2014, that said that governments have a few sources of leverage over increasingly globalized food systems, and public procurement is one of them. And public procurement is a tool by which healthy diets and sustainable food systems can be addressed at the same time. So why do we focus on sustainable procurement in the healthcare sector? As we know, healthcare facilities are major consumers of standard materials and products, and among these products we also include food. So the healthcare sector should pave the way, we think, in procuring food that does not compromise the world's capacity to produce food in the future, that contributes to combating climate change, to preserving biodiversity and protecting the ecosystem, and the food that is procured by the healthcare sector should not contribute to causing non-communicable diseases and should prevent malnutrition and guarantee fast recovery of patients. To do that, the healthcare sector should serve meals that are locally and organically produced, rich in vegetables, fruits, pulses, whole grains, low in meat, sugars, and saturated fats and salt. So we think that the healthcare sector should educate patients, visitors, and the entire community towards a plant-based diet. But if we look at the policy scenario, what do we have to actually implement sustainable, healthy diet guidelines? We have just a few dietary guidelines that secure good nutrition and address climate change worldwide. In fact, only a few countries address both healthy food and sustainable food systems, and this has been studied by the Food and Agriculture Organization in a study that was published by the FAO in 2016. The Sustainable Development Goals are also talking about food, and actually food is featured in all the Sustainable Development Goals that were agreed in 2015 and that are replacing the Millennium Development Goals. In Sustainable Development Goal, there is a link between healthy nutrition and sustainable agriculture. But apart from that, as I said, there is very little in the guidelines, in the dietary guidelines, to address both healthy food and sustainable food systems. In Europe, sustainable food systems, discussion around sustainable food systems has started already in 2011. And in 2013, the European Commission started a stakeholder consultation on the sustainability of the food system. And this consultation was supposed to result in a communication proposal or a strategy that was expected to be adopted in 2014. And it was supposed to be on sustainable food consumption and sustainable food production. But unfortunately, it was never adopted, this proposal, and instead the European Commission decided to focus on food waste and to address food waste in the circular economy package. The proposal was adopted by the European Commission in 2015, and the the circular economy package addresses food waste and encourages member states to adopt food waste reduction strategies in line with the Sustainable Development Goal 12.4 that says that by 2030, per capita global food waste at the retail and consumer level should be halved. What Now, besides all these policies that are not really addressing the problem of sustainable food systems and are not providing a real definition of sustainable food and not even a definition, a European definition for food waste, the healthcare sector and the hospitals that would like to procure healthy and sustainable food, they have only two policy instruments at the European level. There is the new directive on public procurement that provides more opportunities for sustainable public procurement, both green and ethical. And then there is the revision of the green public procurement criteria for food and catering services. These criteria are being developed at the moment and they will be adopted in 2017. And the criteria set the procurement of organic products, seasonal products, fair trade products, and also they include other aspects such as menu planning, staff training, waste sorting and disposal, fleet transport and delivery planning. As I mentioned, HCWH Europe carried out a survey on healthy and sustainable food, and before starting the survey, defined sustainable food as by sustainable food and healthy food procurement. HCWH Europe means procuring food that is fresh, organic, or produced with integrated pest management methods. Also food that is locally produced, that contains high levels of vitamins, minerals, and essential fatty acids. The procurement of healthy and sustainable food is very important, and it could be also improved by reducing food waste. That's why we also included in our survey another aspect, the one of preventing and reducing food waste, because we saw that many hospitals are also acting in this sense. And actually, by preventing and reducing food waste, the hospital reduces its cost and can redirect its resources towards procuring healthier, high quality and sustainable food. So we initially reached out to 320 hospitals and health systems, and then we selected 18 healthcare institutions, 15 hospitals, 1 healthcare procurer, and 1 hospitals association, and 1 public caterer that were selected on the basis of their procurement of healthy and sustainable food, and also their commitment in this sense. Most of the hospitals that we interviewed, they prepared the food in-house, where staff was employed by the hospitals. But then we had also a couple of hospitals that prepared food in-house, where catering services were outsourced to hospital catering providers. They all had a common characteristic, so that was having an on-site central operating kitchen. So we then, by interviewing all the catering managers of these hospitals and systems, we highlighted a few challenges in procuring sustainable and healthy food products and food produce. A challenge is precisely purchasing fresh, seasonal, local and organic food, because hospitals need larger quantities of food. Often they operate on a 4-week menu cycle. And also, they aim to procure quality food, and it's not always possible to find a large quantity and high quality of food when the hospital insists on having only fresh, seasonal, local, and organic food. Then another important challenge was menu planning. Menu planning is another challenge because hospitals, they they procure food for a large amount of patients, and patients are admitted and released by the hospitals every day. So the number of patients is never precise, and it changes all the time. And therefore this is a challenge, and also the challenge is that a menu, an all-purpose menu, needs to be established, because patients are not patients also they follow different treatments, and therefore they might need to have a different menus, to have access to different menus according to the treatment that they follow. Then another challenge was to rely more on plant-based diets, and this is something that many hospitals are striving for, to reduce the procurement of meat and fish, and try to focus on plant-based diets that are it's scientifically proven that plant-based diets are have less an impact on the environment. The recommendations that we felt like providing for procurement of sustainable and healthy food in hospitals is for hospitals to have an on-site central operating kitchen, because in this way it's also easier it's important to cook the food on site, and if possible also to cook homemade food with as much as possible ingredients that are locally grown and also organic and fresh. So the recommendation is to have a green procurement policy with a priority for fresh, local, seasonal, and when possible organic produce, and to do that rely and support local, regional, and small-scale farmers and rural communities. So the hospitals that we interviewed, some of them they have really made a lot of effort in contacting the farmers, the local farmers, and in establishing contracts, long-term contracts with the farmers, although this is not always possible, because, as I said, the hospital need a large quantity of food. But the recommendation is to try to shorten the supply chain in order to contact and meet with the local farmers and establish a direct contact. Then another important element is to carry out satisfaction surveys, so to get the feedback from the staff or from the patients, to know what the patients would like to eat and what they prefer, and then offer a more plant-based diet that is rich in fruit, vegetables, whole grains, pulses, and nuts. Then, as I said, one aspect of our survey and our interviews was focusing on prevention and reduction of food waste. The challenges in hospitals for preventing and reducing food waste are due to the fact that often staff is not trained and is not aware of the food that is wasted in the hospital, and also on the environmental impact that food waste has. And so it's very important to train staff, kitchen staff, but also nurses, management, and to raise awareness. It's also very important, and this has been highlighted also by John, to have ordering systems that are not, if possible, based on papers, but are that can rely on databases. And it's many hospitals now are starting to introduce food hosts, like the Rotterdam Hospital, food hosts that carry tablets and that can take orders from patients, and that can also make the link between the kitchen and the patient. And this is very important because it will shorten also the time between the orders. Usually hospitals the ordering time is of 12 and or 24 hours, so a patient can order its meal the day before. But if this ordering time can be shortened to 2 hours before the meal, then the patient is more likely to know what he feels like eating, and he will eat his meal. Then another challenge are the portion sizes, and also to know the preferences of the patients. Portion sizes, because many hospitals realized that they were providing large portion sizes of food, and they started to offer different portion sizes to patients. Our food waste recommendations from the survey and the study that we did is that it would be ideal if an hospital had in place a system to measure food waste, to realize how much food is being wasted and where, whether it's at the kitchen level, whether it's in the wards, whether it's in the canteen. Then, as I said, staff training and education, and also a simplified and flexible food ordering system with reduced time between orders. The possibility of choosing different portion sizes, and also the possibility of having protected meal times. This is very important to allow patients to eat without being disturbed, so that this would encourage them to finish their dishes and assist the patients that cannot eat by themselves. So probably the food host could do that, could cover that role. It's very important, the communication between the kitchen and the ward staff, so the food host could play the role, and in some hospitals the kitchen staff the kitchen staff serves food to the patients, and that has worked very well in knowing what, in having direct feedback from the patients and knowing exactly what the patient's preferences are. Then another action that is being carried out by quite a few hospitals is to donate food to charity, and particularly food that is not served to patients, food that is leftovers. Leftovers for the kitchen, they are often or given to the canteen or donated to charity, and this is a very good idea. Here I have highlighted 3 best practices from our survey. One is in Denmark, a very progressive hospital, Gentofte Hospital, a hospital of 227 beds with 20,000 inpatients and 200,000 outpatients per year, serving over 300,000 meals annually. They purchase fresh, seasonal and organic food. For 75% of the food they purchase is organic, and the food is produced exclusively in Denmark. And they have an on-site central kitchen, and they make their own food, including marmalade, bread and cakes. They have started providing patients with smaller portions of food, and the kitchen staff, instead of the nurses, serves the food to patients. And thanks to this model of procuring food, sustainable food ingredients that are cooked in the central kitchen, the hospital has reduced the cost, and because they could actually focus on this homemade food directly from raw materials. So this reduction in cost is expected to reach 100,000 euros per year in the next few years. Also, they have reduced packaging and plastic by serving meals in china plates, and this makes also the food more attractive, and to the patients are more likely to finish their meals. Another hospital is the Centre Hospitalier du Bois de la Baie et de Hesbaye in Belgium, and it includes two hospital sites, one in Seraing and one in Waremme. And the site of Seraing has 500 beds short stay and 750 beds long stay. They have a central kitchen, and what is really excellent about this example is that the central kitchen of the hospital has 200 employees, 250 employees, and they not only serve food to the hospital staff, patients and visitors, but also to the entire city of Seraing. It's a small city in Belgium, but all the public institutions, the municipality, the schools, they all receive the meals from the hospital kitchen for a total of 8,000 meals per day and 3 million meals per year. And the average meal price is only 2.30 euros for short stay, 1.85 euros for longer stay. They try to focus also on fresh, seasonally and locally produced food. Organic food is served in the hospital only to staff and not to the patients because of security and traceability reasons. And patients can choose their meals from a menu that varies every week, available for breakfast, lunch and dinner. And also, until not so long ago, the meals were served to the patients by the staff kitchen. But now the situation is changing because in Belgium a new law has been come into place, and the law says that nurses have to serve the food to patients. And this is really pity because this system of kitchen staff serving the food to patients would reduce the food waste, and the hospital is starting to work on food waste sorting and disposal. The last hospital is the New Mayor Children's Hospital in Italy. This is a hospital very similar in size but also in model to the Gentofte Hospital. 220 beds, serves 160,000 fresh meals per year, and the meals here as well are made. They use organic fruits, vegetables, oil and meat that are bought locally, and they follow the seasonal calendar. Here the menu are 2 weeks menu. There is a 2 weeks menu turnover instead of 4 weeks, and they have a vegetable garden that is used for therapy, and they also provide cooking classes to parents of the children because they want to educate the parents to continue cooking fresh, local and sustainable food also at home. I would like to say that in October we are publishing a food waste in European healthcare settings flyer and a report collating all the results of our survey on healthy and sustainable food in hospitals. Thank you very much for your attention. Now I would like to address the questions that have come through the chat box. And I will take a first question for John. What was your food wastage figures prior to the new service being implemented, and what is it now? So what was the food waste before the new service was implemented, and what is the new figure now? John?
Yeah, our food wastage prior to starting the new contract was around 5 to 6%. Over the first year of the new contract, we've seen that now halve to around 2.5 to 3%. So it's been quite a good saving that's been made through introducing this model.
I would like to ask now a question to Gaynor. Is innovation procurement in line with regulations?
Innovation procurement, yes. I mean, all the work that we have done has we've been working in this area for 10 years now, and we always work within the procurement regulations, and indeed the process was designed together with our procurement agency. However, I think now that was obviously the situation in the UK. As the new regulation, what we did find is that the people were struggling to deal with certain aspects, particular supplier dialogue. in some countries. And also there were a lot of concerns around fraud in some countries, and that if you talk to suppliers and evaluate on factors other than price, this actually increases the chances for fraud. Particularly cases in Italy where they have a highly controlled public procurement system. Now the new regulations are going to help that enormously, but it will be quite a big cultural shift. And in fact, when you actually talk to people about implementing this kind of project in that environment, actually what you can see is that the excessive regulation has more chance of increasing fraud rather than reducing it, but I think that's probably another story. So in answer to the question, yes, it's completely in line with public procurement regulations, and you can always adapt and develop the process to make sure it is, and also try certain parts of it to build confidence in the process. Because even if you can't complete the if you like, a classic full-blown innovation procurement project, you can adapt and develop parts of it, or take one certain element like prior information notices. Just let suppliers know what you'd like using outcome-based specifications. Start simple and build confidence as you go.
Thank you very much, Gaynor. I have another question for John. John, how important is for clinical staff to be engaged in the process to make it successful?
It was really, really important. The only way it will become a success is if clinical are engaged right from the outset. They need to own the project as much as we did, because at the end of the day, they have to deliver it to the patient, and they are responsible for patient nutrition. So it's quite key that they are involved all the way through the process.
Thank you very much, John. I have another question for Gaynor. How is the risk of innovation dealt with or managed?
It is quite true that innovation is inherently risky, and if I were you, I would avoid it at all costs if you can. But I think part of the problem is that we fail. There are two things. We fail to recognise that we need innovation because we avoid it because it is risky. And secondly, we fail to consider the consequences and the cost of not innovating. So I think we often hear the word innovation and just feel exceptionally worried. That's quite sensible. But the truth is that as long as you use a process that manages the risk of the innovation, which is what forward commitment procurement was designed to do, by breaking the process down into a step-by-step process, you just do each step, and if it makes sense, you move on to the next step, and you minimise the risk in that way. Because if you identify what the unmet need is, and you go to the market and the supply chain says that's not really possible, you can just stop then. But if the supply chain says, yes, actually we could do this, and we can do it in a way by we need to remove these barriers, then you can, or we need to overcome these problems, then you've already understood what some of the risks will be, and you can help the supplier to manage those risks. So the process in itself is inherently designed to manage the risk. And in fact, we wrote a paper that was published in the Social Science Special Edition on Innovation that discussed how this process managed the risk, if anybody is interested in that.
Thank you, Gaynor. And I would like to read a very interesting comment that we have received, some questions, and maybe the questions are for both of you, Gaynor and John. An attendee says that we have just launched a program called Nourish, the Future of Food in Healthcare, to work with 25 healthcare organizations across Canada. Sometimes we come across the same reaction, that we are doing that already or that it is too risky. How have you been successful introducing or managing those new ideas and change? And how can we access case studies that we might be able to share with our group? Well, for the case studies, as I said, we have a number of case studies thanks to the survey that we've carried out for a couple of years, and they will be available in our publication soon on our website. And then there are a number of case studies on the EcoQUIP website. But I'll leave the floor to Gail.
Thank you. Yeah, that sounds really exciting. It's quite difficult to do something innovative with a large group of people all at once. It is quite hard to do that, I think. And I think the risks that you encounter, depending on the nature of your network, but I would always prefer to work with one particular, if you like, leader, who would then set a new standard and then ask the other people to join in with it, who can then comment and debate. Otherwise, what could happen is that you might end up, I suppose, working to the lowest common denominator. And then by setting that, if you could do, I could imagine a process in my head, which I'd be very happy to sort of discuss with you, of how that might work, but I won't go into detail here. But I honestly think that working with one organisation who's really committed to take the leading role and then engaging others behind that initiative can be a much more efficient way of doing it. And it means that you're not trying to enrol a lot of different people at the same time, just one or two to start with, and then have others come along with you who might adapt part or sometimes all of the solutions that have come forward. So that's one suggestion.
John, do you have another suggestion?
I think for me, it's about having strong project management skills and belief in the project, and you particularly internally here, we had to sell the project to our clinical colleagues, whilst it was sold within the directorate and within the non-clinical side of the hospital. It was key that we ensured we got the right mix of people that came and supported us, and so we were quite clear on, it wasn't about people coming with their own personal agendas. This had to be something for the organisation that benefited both the organisation and the patients, because everyone will get a win-win out of all of this. So we were quite clear on the type of people that we wanted on the project, that were committed to improving patient experience, patient care, and patient food, and that's how we tackled it. And I think Gaynor will probably back me up when there was quite a few frustrating times when our clinical colleagues didn't give us the support that we felt we needed, which we quickly got round.
Thank you very much, John. And then I would like to read the last comment. With central kitchens, the hygiene is extremely important. Actually, we start to prepare food for the babies under laminar flow, and that lowers the number of infections by food for the babies. So, I think we have, run out of time. And thank you to all the participants for staying with us until the end of the webinar. And thank you to the speakers for their excellent presentations, to our guest speakers. We would really appreciate when you leave the webinar if you could answer our satisfaction survey at the close of the webinar and also sign up to Healthcare Without Harm Europe newsletter. You see in the closing slides you have the email addresses of the speakers, so you're welcome to contact them if you have any further questions. Thank you very much, and I wish you a very nice afternoon.